How to protect from coronavirus during pregnancy. To follow up on these issues, please click subscribe and like. The whole world is busy today with methods to prevent this virus, coronavirus, and its daily experiences in testing treatments and medicines against this virus, and to this day we have not reached any explicit treatment for this virus. Only the natural immunity of the human body that God has given us. Thus, in this article we will talk about 1. What is coronavirus? 2. Who is more susceptible to coronavirus infection? 3. Ways to prevent a coronavirus for a pregnant woman. 4. How to increase the immunity of the pregnant woman's body. 5. Is the virus transmitted from mother to embryo? 6. What do you do when you were giving birth during this period, the spread of coronavirus? First, what is coronavirus? First, we will show you the symptoms of infection with the coronavirus, as WHO studies have shown that there are 4 symptoms that appear when you are infected with the virus: 1 high body temperature, 2 dry cough, 3 headache in the head and pain in the body, 4 sore throat and difficulty breathing. As the World Health Organization realized that it is a global epidemic, after the United States of America, the European Union, Africa and of course Asia was infected. Second, who is most exposed to the coronavirus? The elderly, patients with heart disease, diabetes and those with lung and respiratory diseases are the most vulnerable to severe injuries. However, young people are less likely to become infected, due to the strength of their immune system. While a pregnant woman has a degree of infection between both the elderly and young, that is, she is not more or less likely to be affected. A British study at SI UK University has shown that the immune system of a pregnant woman is relatively weaker than usual. Third, ways to prevent corona in pregnant women. As with other people, you should use the ban and the obligation to contract with SK, as it is transmitted through the respiratory tract, so follow these instructions. Avoid contacting people in crowds or crowded places completely. Avoid the wounded completely. Make the distance with anyone at least 1 meter and 1 text. Avoid touching the facial area permanently. Wash your hands with soap and water for at least 20 seconds, or use a hand sanitizer that contains at least 70% alcohol. Sneezing in napkins. Do not share cutlery, household utensils, and bed linen with any patient at home or if you are sick. Daily hygiene for the home in which you live. Avoid eating foods that contain uncooked meat. Avoid processed foods and more. Staying at home and leaving it only if necessary. It is best to avoid going out completely, which is the most important degree of prevention. If you do not leave the home, you are 90% safe from infection with the virus. Fourth, how to increase the immune system of a pregnant mother. As mentioned earlier, the mother's immune system is relatively weak during pregnancy, so follow a healthy and proper diet and avoid harmful foods and drinks during this period. The most important thing is to increase the efficiency of the immune system. Here are expert advice on optimal nutrition for pregnant women. There is a list of foods and drinks that should pregnancy eat. Follow the previous video. Also, there is a list of foods that should be avoided during pregnancy. Fifth, is the COVID-19 transmitted from mother to embryo? The answer is no. The ability of the virus to transmit from the mother to the fetus has not yet been proven, because as we mentioned it is transmitted through the respiratory system. No case has been identified yet, and also if you are carrying the virus, be assured of the fetus because there are no complications related to pregnancy, such as increased chances of miscarriage, or affecting the development of the embryo in the womb. All you have to do when you have the virus while you are pregnant is quarantine, non-contact, and eat healthy food that strengthens your immune system in order to beat this virus. Sixth, what does a pregnant mother do during childbirth with COVID-19? The danger here is that you can treat this virus with your immune system, as well as experience the symptoms of childbirth. Coronavirus infection may affect your breathing during childbirth, but by following these instructions, you will give birth well, and be sure to follow the advice. Thanks for your watching. Stay at home.